Assalamualaikum warahmatullahi wabarakatuh and very good evening. So today I want to talk about Klinefelter syndrome. What come on your mind when you look at this image? Yes, these are what a person with Klinefelter syndrome would see. Klinefelter syndrome is a genetic condition that affects boys. It is named after Dr. Henry Klinefelter, who first described the Klinefelter syndrome in 1942. He described 9 men who had breast development, small testicles with no sperm in their semen, and a blood test revealed raised level of gonadotrophins, which try to produce more and more of the male hormone and greater numbers of sperm. Around the world, roughly 1 in every 600 boys that are born will have Klinefelter syndrome. Why does Klinefelter syndrome occur? Unlike other genetic conditions, it is not directly inherited from parents. The conditions happen randomly when the genes are first formed. Our genes are like a code which determine how we look and how our body works. All of these genes are wrapped up in 46 chromosomes which are found in every cell of the body. Of these 46 chromosomes, one pair is different between boys and girls, which is the sex chromosomes X and Y. For your information, girls have 2 X chromosomes while boys have an X and Y chromosome. However, in Klinefelter syndrome, there is an extra copy of the X chromosome. Most commonly, this means that instead of their chromosomes being 46 XY, there are 47 XXY. The extra chromosome means that their bodies develop slightly differently. The testes do not function properly and produce less of the hormone testosterone. The syndrome is very variable and some boys have very few obvious symptoms. Knowing the characteristics and problems of it would result in the best outcome. Before we go to the characteristics of Klinefelter syndrome, let's take a look at this graph. This graph is about Klinefelter syndrome prevalence and diffusion. This graph shows us that Asia have the most number, which is 2,400,96,047, while Australia have the least number, which is 7,895. All the researchers still cannot conclude why Asia have the most numbers of Klinefelter syndrome. We move to the next graph. Okay, this graph is about postnatal diagnosis for Klinefelter syndrome. The graph shows us that the most percentages of Klinefelter diagnosis, which is 21%, are male from 40 until 49 years old, and the least number is from 0 until 9 years old. As they grow older, they begin to see the symptoms of Klinefelter syndromes in themselves. So now let's move to the characteristics of Klinefelter syndrome. For your information, these symptoms of Klinefelter syndrome are typically simple to identify. Through the person's physical appearance, we can already identify it. Firstly, the most symptoms that person with Klinefelter syndrome have is infertile. They incapable of unsuccessful in achieving pregnancy. Number 2 is slow sexual development. And number 3 is hypogonadism. Hypogonadism is a condition that will reduce the function of testes. Although the testes have reduced function, almost all boys with Klinefelter syndrome are male in appearance. Next, lack of sex hormone. Because of this, their progress to a normal adult genital appearance may be slow or incomplete compared to other boys. For example, their testes are small from birth and grow relatively during puberty, and they have less facial and body hair. They also have slender muscles and relatively wide hips. And lastly, the development of breasts. They will have breast development during teenage years and may be persistent. We also call this condition as gynecomastia. Now now that you know something about the characteristics of Klinefelter syndrome, let's look at the problems of Klinefelter syndrome. This disease should not be underestimated because it will get worse when we do not seek further treatment from the doctor. Individuals with Klinefelter syndrome tend to have anxiety, depression, impaired social skills, behavioral problems such as emotional immaturity and impulsivity, ADHD, and limited problem-solving skills. About 10% of boys and men with Klinefelter syndrome have autism spectrum disorder. Apart from these problems, men with Klinefelter syndrome also have a slightly increase of developing other long-term health problems, including weak bones, or we can call osteoporosis. Next, increased risk for breast cancer. And number 3 is other cancers that affect blood, bone marrow, or lymph nodes, such as leukemia. Lastly, excess fat around the abdomen, which raises the risk of health problems. For example, heart and blood vessel disease and type 2 diabetes. That's all the problems and risks that person with Klinefelter syndrome will have. In conclusion, people with this disorder are still a person like us, who have feelings like others. So we should not distance ourselves from them, but we should provide support for them. They are still have treatments for Klinefelter syndrome, but they must accept the fact that they cannot get rid of the condition completely because it is still not possible to repair changes in sex chromosomes. They can have speech therapy that can help them in overcoming such problems with language speech, and they can also do the testosterone treatment. I think that's all from me. Thank you.